A 27-year-old male came to my office because his bite didn't feel right and he was unhappy with his lower facial appearance. This problem needed more than braces. He required surgical movement of his lower jaw and chin. Check out the full case today on the Open Reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolten, and today we're correcting a Class 2 skeletal discrepancy to improve both function and facial balance. A Class 2 skeletal discrepancy is where the lower jaw is underdeveloped relative to the upper jaw. This patient is a healthy 27-year-old male. He presents with a retrognathic mandible and a chin deviated to the left. I saw him for a consult and determined he was a surgical candidate for correction of these problems. He subsequently went to an orthodontist for leveling and aligning of his dentition in preparation for surgery. He completed pre-surgical orthodontic alignment and now he's ready for a surgical workup. He has a convex facial profile and a retruded chin, typical of a Class 2 discrepancy. The goals of surgery are to bring the mandible forward, correct the midline, and create harmony between the upper, middle, and lower facial thirds. Once I establish he's ready for surgery, I obtain a cone beam CT scan and a digital scan of his dentition. All of this anatomic data is uploaded to a medical modeling company, and then I perform an online virtual surgery. The virtual surgery is invaluable because it allows me to determine down to 1/10 of a millimeter where the optimal jaw position is for this patient. Once I'm satisfied with the results, the company makes custom models, splints, and cutting guides, which I use in the operating room. This allows for incredibly predictable surgical results. The plan calls for a bilateral sagittal split osteotomy with a 4 to 5 millimeter mandibular advancement and a sliding genioplasty to center and correct the midline of the chin. This procedure is performed in the hospital under general anesthesia. After sterile prep and draping, I begin with the bilateral sagittal split osteotomy. A mucoperiosteal flap is raised to expose the mandibular ramus. I use a Lindemann burr to make the medial and vertical bony cuts. I then use a Steiger burr along the lateral cortex, extending from the medial cut above the lingula down to the vertical cut along the buccal aspect of the mandible at the first molar. It is important to confirm the buccal cut is carried all the way to the inferior border of the mandible and completely through the cortex. The mandible is split sagittally using chisels and a mallet. This separates the proximal segments, which includes the condyles, and the distal segment, the tooth-bearing portion of the mandible. Once both sides are mobilized, I advance the distal segment 5 millimeters using the prefabricated splint to guide occlusion. I then use a trocar to achieve rigid fixation using bicortical screws. I verify that both condyles are seated properly and also that the teeth are in the splint correctly. Next, we perform a genioplasty to correct the chin deviation. I first make a vestibular incision and expose the symphysis. I identify the mental foramen bilaterally. I secure the cutting guide and then perform a horizontal osteotomy using a reciprocating saw. This frees the chin segment. Once ideal symmetry is confirmed, I secure the genio segment using a custom titanium plate and screws. The segments are irrigated thoroughly and I close this in layers. Here is the post-op cone beam CT and I'm thrilled how everything looks. The 3D reconstruction confirms excellent alignment of both the mandibular segments and the genioplasty. The occlusion is stable and facial symmetry has been achieved. This case demonstrates how orthognathic surgery not only restores occlusion and airway volume, but also enhances facial aesthetics and self-confidence. Bilateral sagittal split osteotomy remains the gold standard for mandibular advancement. The genioplasty allows for fine-tuning of facial harmony. Thanks so much for watching. Please click those like and subscribe buttons and check out my channel for additional interesting OMFS cases like this one. Also, if you're a provider interested in surgical continuing education credit and great courses, check out my website, theopenreduction.com. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.